right, friends, we have a quorum so we can get started. Yes, wait, okay. All right, and action. All right, we have a quorum, so we're going to go ahead and get started. All right, so I'd like to call this meeting to order and welcome to our council members and those of you that are here from the public. And a special welcome to QQ Research. Forgive me if I say Q and Q. I'm going to get it right. Okay. QQ Research Consultants, who I will introduce in a moment. All right, so the logistics of this meeting, this is a workshop, and this workshop is for the council members so that we can begin our visioning session with QQ Research Consultants. Because this is a workshop, we will not take public comment at this time, so there'll be no public testimony. And this meeting should end at 3 o'clock, although it might extend a little bit beyond that. We will then adjourn and then have a 10-minute break. And at that time, we'll start at hopefully around 3 o'clock for our board meeting. All right, so any of us that are speaking today, make sure you speak directly into your microphone so that our friends that are streaming in can hear us clearly. To give a little background, you know that our Needs Assessment Committee led by Dr. Glenn has worked really, really hard to bring us to this day and to this moment that we're really excited about. We entered into a contract on October 21st with QQ Research Consultants to conduct a comprehensive assets and needs assessment for our community. So this process began on November 1st, and it will be projected to end on June 30th of 2022. Our council staff, Holly and Ted, has spent quite some time with QQ. I got it, I'm not gonna mess it up with QQ, and our council will meet later this afternoon to review the needs assessment work plan. But the first step of this process is for us to be on the same page when it comes to collectively having our vision for how we want to move forward. So one part of what set QQ apart from their competitors was that there was an understanding of having a cohesive vision for this process. And not only between the council and QQ, but also amongst us collectively, which I think is a really big deal. And what makes me so excited about today is that we've gone through the foundational work to get to this point. So we've gone through all this trim. I didn't even know what trim was until we entered all of this, but we've come to a place where we have set the foundation and we're ready to move forward to do the fun stuff. That's the part I'm excited about, to get to know what are the strengths of our community, to know what we need. And when we come together in this forum, now we're here and we're ready to collectively say, okay, here's our vision. So I would like to introduce our facilitator for this session today, Dr. Sandra Williams, and she's the CEO and principal investigator of QQ Research Consultants. Dr. Williams oversees all of the strategic and business aspects of QQ and has led successful research and evaluations for other children's services councils, early learning coalitions, the college access network, Chamber of Commerce's and workforce development boards, foundations, and state and local governments, including the Florida Department of Education, the U.S. Department of Justice, the Centers for Disease Control, and Florida Blue Foundation. So now it's my pleasure to introduce you all to Dr. Williams, and she is going to lead us through our session today.
I want to make sure that we have a chance to also introduce, please.
Hello, everyone. I'm Dr. Lexi Valmer Rivera. I'm the research manager with QQ and very excited to be here with you all today. Thank you.
So every now and then you may hear Lexi jump in. And so I wanted to make sure that she had a chance to introduce herself. So I'm so excited to be here. I did want to sort of share how I see this session going. I want it to be known that I want us to have a discussion. Feel free to stop me at any point. This is really our chance to hear from one another about our vision, our thoughts around the goals, around the impact that you guys would like to see in Leon County. So feel free to really just say, hold on, Sandra, stop right there. Let's discuss this. I'll have a few slides that will guide the discussion, and I'll pose some questions back to you, but really it's meant to be an ongoing discussion with all of us today. Okay, so I'm excited because we're going to start the work of the theory of change. Keep in mind that, we're beginning the theory of change. There's a lot of work that's going to be done with the community. And so we're here to sort of begin that foundation, also pull some voices from the work that we'll be doing in January. So we'll start off with the components of the theory of change. We'll talk more about the assets and needs assessment expectations. And we'll also have some discussion around how do we think about aligning action in the community. And then we'll go ahead and conclude. Okay, so you guys may already know some of this work around the theory of change. So I'm just going to briefly sort of go over it. There are two major components as we think about the theory of change. One is the big why, right? What is or what are the conditions of the community that's sort of bringing us here today? What are those things or those factors or conditions that the youth and the children and the families are experiencing that we really want to see the change in, that we want to see the needle move? So that first part, the community condition, the problem statement, you all had a chance to complete a quick survey where you looked at some data and thought about what are some changes that you wish to see. So we'll talk a little bit about that. We'll also talk about the intended impact that you're hoping to see. Again, these questions are going to be posed to the community as well, where we're hearing from them. What do they think the problem statement should be? What do they think the impact that we all want to see? And then once we discover what the why is, why are we doing this? What's the long-term impact we want to see? Now it's time to think about the how. How are we going to do this? What are the strategies that we're thinking are important to fund in order to see the intended impact? And of course, you can't do this work without the outcomes. The outcomes allow us to pause either each year, every 5 years, and stop and look to see to what extent are we meeting the outcomes that we're hoping to meet for Leon County. And then the pathways, how are we going to go about doing this work? And we'll talk a little bit more about that. Okay, so I talked a little bit about the why, right? What are some community circumstances that we see now that we'd like to ultimately change? So I'm going to pause right here and allow you all to just think about what are some changes, what are some problems that you're identifying right now in Leon County? And you had a chance to think about that with the survey. So this is our chance to just sort of have that discussion. What are some conditions that you feel cannot go on in the trajectory that it's going on right now? So this is that moment where I open up the discussion.
I did not fill out the survey.
Oh, that's okay.
Yeah, so I'm thinking, I saw it in my inbox, just one of those weeks. But homelessness, that's the first thing that comes to my mind.
Thank you. Homelessness. Any other thoughts? And as you guys are talking, know that Lexi is right over there just typing away.
Dr. Williams, I did take the survey, and you guys started off with data.
Yes.
And I found that very valuable to set the tone, because there are a lot of needs. And I think that the data, evidence-based data, is really going to help drive the direction, the most appropriate direction, but then also bridging that gap between the community feedback. And how do you bridge those two together? Because they may not line up, but how do you bridge them together? So while I do have ideas of what some of the needs are, I just want to make that emphasis. So I'm probably signing off whose survey was mine, because it talks a lot about that. I think those two are going to be major. Respecting the community, but then also placing a heavy burden on the data and bridging those together to help us with the direction that we go.
Absolutely, absolutely. And so as you mentioned, allowing the data to sort of tell some parts of the story. and possibly speaking to the community to tell us the story behind the data that we're seeing. Any other thoughts? Yes.
One of the things I didn't see was, there were sections that talked about parents and children, but I'm a big believer that unless you change the intergenerational trajectory, you don't have a long-term systemic change. And so I would like to see this thought of as intergenerational from the very beginning, because, 10 years down the road, when this hopefully initiative is still moving forward, if we haven't done what we're supposed to do, we're going to be working with the kids of those folks that those kids we serve now. So I think a really strategic, thoughtful, intergenerational approach is critical.
Thank you for that. So making sure we're thinking about intergenerational change. 5 years from now, as you mentioned, we're looking at maybe 5-year-olds now, and then 5 years they're 10, and then so the trajectory for the generation. Thank you.
Well, not only that, but that the parents have to be engaged as much as the children in the solution.
Absolutely. Thank you.
I do want to piggyback on what Liza is saying, because one thing that's really important to me is family support. We can solve a lot of social issues in the moment. We can give somebody some place to live. We can give them something to eat. Those will fix the immediate problems. But if they don't have that foundation support of their family, they will continue to be in those situations years down the line. So what I'm looking for is, how do we build the family infrastructure to prevent homelessness, to prevent insecurities, to ensure that these children are appropriately educated? And if we can't build a system, a family infrastructure that will support them through adulthood, they will continue to fall through gaps. So I'm hoping we can address those issues. And I think building the family system eliminates a lot of the other problems down the road.
So happy you mentioned the system. And we're going to talk more about how do we think about making changes within a system, a family system, and then a larger system at that. Any other thoughts about problems or conditions that you see in Leon County now that you really hope to see change?
Yeah, I was thinking in that same vein as Liza and Zandra. How do we maintain in the long run healthy children, healthy families? And there's so many aspects of that we need to delve into with, what is it? The high birth, the death rate, with the children and families, school readiness, their failure to read up to a certain, grade level. And I think it has to be approached to look at, from a holistic standpoint. And we do start with some analysis of how we can best attack that particular issue. And I think, like Dr. Glenn said, if we address some of the major problems, some of the other problems will take care of themselves. And I recognize that overarching, and it might not have too much to do with your survey, but overarching, we need families where the parents can earn a livable wage, where they can become homeowners and as I always say, take part, enjoy the American dream. And to a certain extent, where parents are able to do that, then they are moving themselves from a socioeconomic standpoint into another level. And that has a positive effect on the children in the household. So I think we're all saying the same thing.
Yeah. And I was going to say, as a Title I school principal, that what you all said directly impacts me every day. Initially, I was going to say that the majority, half of my kindergartners that come to school have never gone to school. And that sets up a huge problem for us because we have to have interventions and it requires people and resources to put these things in place. But the barriers that exist at my school, in addition to that, is parent involvement. A lot of our parents work multiple jobs, which makes it difficult for our kids to do extra things, but even to show up to school on time. or to show up often. Very often in Title I schools, our least populated day happens on Mondays and Fridays. So we're working with 3 days during the week. And then we're working with children who may not live in their own home, and they live in a home where there are multiple families and they don't have their own beds and they don't get the proper rest. And there are a lot of barriers that exist in my world.
Before they even step in the door.
Right. And it's about how, if I knew, I would have done it already. How do we impact families so that education is a priority and coming to school on time is most important, and reading at home for 20 minutes a day just happens because that's just as important as brushing your teeth. So that family impact, I agree, is huge and would change the lives of all of my students if we could change that little piece.
Another thing I wanted to address was, I'm the oldest of 6 kids, and I can remember when my dad would be grocery store or wherever you, and somebody would say, well, next baby, do you want it to be a girl or a boy? And he'd say, I want it to be happy and healthy. And, you know, I think if I were to rate the biggest challenge in here in Tallahassee, Young County, didn't see it on the list that we had in there, was behavioral mental health. It is systemically impacting almost all of these issues that you see, from homelessness to children not reading, et cetera. And so, you know, I hope somehow we think of whether it's in education with social emotional guidance being layered into the reading or what have you, that we're cognizant that this community has extraordinary lack of support for those with behavioral mental health issues. I work very closely in the homeless community, and, you know, chronically homeless almost always have mental health issues. People that are underhoused almost always have chronically mental health issues. So you were asking that question about what would you prioritize? It wasn't something on that questionnaire that I would prioritize, but if it were me saying, what do I see as the connecting issue that's very troubling this community? That would be my answer.
Thank you. That's a good point. I don't want to, you didn't ask for strategy at all, but I'm gonna jump there a little bit.
That was intentional.
Okay. But you know, one thing, I don't know, one of my brothers told me this, but you know, whenever they are training federal agents about how to identify counterfeit money, they don't look at bad counterfeits. I mean, they don't look at counterfeits at all. They don't say, this is you know, you could tell it's fake because of this. You could tell it's fake because of this. They make them study the real dollar. And if they can master the real dollar, they will automatically pick up a counterfeit whenever they see it. So they just focus on, here's how you know a real dollar when you see it. And then everything else falls in place. I'm hoping that part of our strategy could be really looking at children that are healthy, that are happy, that read well, that are excelling. They have all of their needs in place, and what makes it work for them. And I think that if we are studying the real dollar, you know, that's my example, then it's easier to understand where those gaps are. So, you know, and I don't know how that's going to work. That's, you know, why we have you all here. But how do we really find the things that have been really successful, that works well in certain communities, that exemplify children that are high performing, and then what do we not have in place and how do we fill that? So I think that is a way for us to approach this, to be able to come up with some solutions and identify gaps.
That's a perfect segue, because I want to take some time to talk about, so what would the long-term impact look like? So if we were successful in doing this work 5 years down the road, what would it look like? What would success look like for children, youth, and families? What would we no longer see?
So I'm going to dream first, and I know this is utopia, but honestly, you know, I know that we have a lot of emphasis on certain populations, but I do want to make sure that this body of work addresses every single child in Leon County, like every single one, regardless of where they come from, regardless of, you know, economical status, regardless. But, you know, I want to see them all healthy. There is no reason, given the medical advances and access to care that's right here in Leon County, that we should have any children that are not living the healthiest life that they could possibly live. I want to see them all excelling in school. Why? What are the things that are preventing kids from excelling in certain situations? I want to see them happy, just like with the mental health issues. If we are able to identify these things and have systems in place, then why is it that some of these kids are falling through the gap, that we are smart enough to be able to put things in place? So I want to make sure those types of things are addressed. To me, that's success. And I used this analogy before, a puzzle picture, just similar to what you have up there, that really shows, all of these different kids in different stages and areas of life that are well adjusted. And we have the resources here in Leon County. Let's make it applicable to everybody so that all of these kids are able to meet their highest potential. So that's my success. Every child achieving their highest potential and not limited by barriers that can easily be removed if we just fixed the system. I hope that makes sense. I don't know, but that's just how I feel
Hope we
about
got
it.
all that, Lexi. That was awesome. Any other thoughts about how you want to see the problem that we just quoted, some of you guys shared, fixed? Like what would that look like? Again, we're thinking utopia, best case scenario. What would that look like? Any other thoughts?
I think that how my brain works or doesn't work. It's hard to try to come up with, what I would want to see, because I'm like picturing what it is that we're focusing on. But in general, I think big picture, if we were able to or had things in place to identify early on that a child or whatnot might be impacted, or a red flag or something along those lines, that there were tools in place to act on those. Whoever, if it's the school, they notice that, they had the resources. I see this is going on. I can automatically, let's go ahead, and we have the tools in place to intervene that's going to be effective. We can rely on it to do the work and make the connections with what that is, where there's trauma or something in the home on a bigger level, wrap around that situation to address it and know that it's being addressed. I think that big picture that's there. We have a lot of agencies doing a lot of things, a lot of people specialize, but if I see a red flag and I can get someone to wrap around that and trust that they're going to follow that process through, it might not just be a week, or they can't get a hold of the parent, there's not buy-in, but they're going to circle back around, follow that through all the way through. I think if there's a solid process in place for that, I would like to see that versus things that fall through the crack.
I could add real quick, there's some wonderful comments. I mean, I think we all agree there are many issues to address. Selfishly, I'm like Ms. Connor, as superintendent of schools, concerned about our kids' education and their preparedness or lack of preparedness when they arrive to us, or arrive to Ms. Connor anyway, in kindergarten or in pre-K programs. And to your point, it almost is if we could mentor, shepherd children that potentially would be identified as at risk because they were born into single parent families or because of the socioeconomic conditions of the family when the child is born, that we would find some way to nurture that parent up until they were ready to hand them off to us, right? Because I don't think there are a lot of programs between the ages of 0 and 4 that really help parents navigate that. And in a perfect world, if we would have a professional tied when they left Mark O'Brien's hospital, our local hospital, if they were identified as being at risk because they certain criteria, that there was someone just kind of holding the parent's hand along the way in those most formative years of 0 to 4, and then hand them off to us. Hopefully, right now we're at about 55% kindergarten ready across the district. Her school is, I don't know, probably 20% kindergarten ready. That they would be more ready for their K-12 experience. And we could kind of take it from there, but we talk a lot about the achievement gap and where the gap why that gap exists. And it starts in kindergarten. They have kids that are woefully unprepared. And then we spend the next 12 years of their life trying to close that gap. But if we get them in a good place when they are 4 or 5 years old, through programs we have in our private providers or whatever with pre-K and early learning programs, but there's someone to ensure that those things are happening in a child's life, and whatever barriers, whether it's homelessness or food insecurities or whatever, that there is someone helping a parent navigate those conditions to get help. Because it's really almost too late. It's not too late, but it's when they come to us at 5 years old, can't spell their own name, or it's just some of the things, if we could do on the front end, would have long-term dividends, which would only then help with third grade reading scores and graduation rates and job attainment and those types of things.
Thank you for that. So as we first started talking about some of the conditions that we wanted to change, right? And we've heard homelessness. We talked a little bit about how we could try to intervene at the family system level. We talked about, give me a sign. Oh my goodness. Okay. We talked a little bit about how we could possibly prepare them prior to getting into kindergarten. And so I just wanted to walk us through, because part of the theory of change is the thought that in the end, CSC Leon County will have its own theory of change. And these components that you guys are talking about, it's how do you take everything that Lexi's typing and really make it in such a way that it's a document that shares how you plan to make those changes. And part of that will include identifying what goals you want to focus on. So the next slide, I want to keep up for a minute. So some of the goals that you all had identified, I just want to put it up on the board a little bit so you all can get a chance to see where everyone's thoughts are, right? So we pose this question to you all. What are some goals that you think we should consider for CSC? And these were some of the examples that you all shared. And so I want to give you a chance to read some of those goals and tell me are there any goals that you see perhaps your fellow board member mentioned that you thought, wait, I hadn't thought about that. This is something that I really want us to think about, including that language when we identify our goals. So I'm gonna give you guys a chance to see it. I'm gonna go ahead and read a few. That first one there says, CSC goals should reflect each of our priority areas, describe the impact CSC wants to have on the whole child. I heard a lot about how we want to be able to provide for the whole child. Any other thoughts as you're looking at, can you guys see it okay? I'm gonna give you guys a chance to read it. So the question is, are there any goals that perhaps maybe you didn't buy as what you thought was important your fellow board member? Right?
So I don't know where this, now I'm really feeling guilty for not having done this survey. It's Connor, I came to school unprepared. I apologize. I remember as a father of 3 boys, my oldest almost 29 years old. When he was born, I looked at him and I'm like, I know how I made him, but I don't know. There wasn't a guide that said, now here's what you do with it. All of the things that I've heard today, I completely agree with, and I'd love to find sort of a way to solve all those problems. But it sort of begins with parental preparation. If you think about the March of Dimes and how they tried desperately to make sure that the mother is healthy and is taking the prenatal vitamins and making sure that she's getting her checkup. There's at some point seems like parental readiness long before kindergarten readiness is a mom and a dad who are ready to be parents. And I'm not sure there's any magic wand. I'm not really sure, if somebody reviewed my 29 years and 20 years and 18 year with my 3 boys, that they would say, you got it right. But I do think that if we did we started at the beginning and made sure that the parents were ready for the responsibilities that they were going to be facing, so that they did get their child to school and stress the importance to getting them to school 5 days a week on time, and the importance of timeliness. So it is, I don't know if it's a goal of parental readiness before the child is born, but as I'm sitting here listening to this, I'm always going back to it starts with the parent,
It does.
So
Just to reemphasize, I completely agree with him. Healthy families create healthy children. So we have to build the family to be able to create, and that's what I was talking about when I said the system. The family system has to be in place to generate what it is that we're trying to produce. So how do we get that family infrastructure where they need to be, and therefore the needs of the children will be met? And if the family isn't right, nothing else, is gonna work. And that's another thing, just a focus on prevention. So what do we need to do to prevent these adverse impacts on our children? We prevent that by building a family infrastructure, a system that works for them.
Diverge just slightly, because we haven't talked about this as a group, but I think as you all are going out, I agree with everything on the goals. There's nothing that I read there that bothers me at all. But I do think as you're going out, this is also setting the image of the Children's Services Council. And so I don't want to be seen as a funding organization, but rather hopefully over time that the community feels that the Children's Services Council is their voice for change, and that they get behind whatever these issues are, whether it's we want every kid adopted in our community, we end up doing an adoption campaign. We want them to buy in and feel that these are their goals as well. And so I think this is terrific, but as you move forward, I'm wondering if there's a way to ensure that the folks feel this is part of their voice and that we're just trying to help raise that level of conversation. And then a very quick secondary point to that, that means that in order to implement those, I think at some point we have to become more policy oriented. So for example, I personally disagree that people shouldn't be able to adopt over the age of 50, right? I think some of those are the most wealthy, they've already raised great kids. Maybe we're gonna have to dive into state level policy issues. And I don't know, we haven't talked about all that, but I'm just trying to think as this moves forward, how we're voiced and how we're considered. And I think it's important conversation for us as a group to think about, because we need to have this, I'd like to hear more about how these goals are going to come back to us after the community's involved and so forth. Thanks.
Thank you for that. And that is exactly what we were hoping that you guys would say, is that one, we're hearing from you all what you think the goals are. We're hearing from you all what you think the ultimate impact should be. The same questions are going to be posed to the community, where they'll have a chance to say, you know what, we believe that this should be an important goal of the work. So know that by the end of June 30th, the thought is that we're incorporating the voices of everyone to have a final theory of change document that has been, you guys are in agreement, the community is in agreement, that it's really a theory of change for the community, with the community, and it's not a separate document that just the board decided that these are not your goals. So that's really the intent. So thank you for that. So the strategies, right? And I know you had mentioned you want to jump into strategies, and that's awesome. The thought is, if we know where we want to go, what are the strategies do you think are important for us to fund moving forward to get us there? And so again, part of that work is looking at strategies that we have found to be successful, speaking to the community in terms of what works, You started a little bit of that work when you thought about the priority, right? So the thought was, if we think about supporting success in school and life, if we think about supporting programs around healthy children, youth, and families, if we think about funding programs or supporting programs focused on stable and nurturing families and communities, that we will get the ultimate impact that we're seeking to have. So you guys have already begun that work. And so another big part of the theory of change are the values. And again, I included some of the values that you guys have shared. And I wanted to take a moment to think a little bit more about the values, have you a chance to see what some of your fellow board members thought were important values. And I'm going to say it that we're also going to go in the community and ask the same questions. And so some of the values you see here that you all mentioned were respect, community, investment, learning, strength, partnership, change, compassion, security, support, inclusion, action. So the values that you see here, the thought is that the values are important in how you approach the work, how you engage with the community, how you decide to make change within Leon County. Are there values that you see on the slide here that perhaps your fellow board member mentioned that you hadn't thought of, but yes, it's absolutely important that we consider including these values in the work?
Dr. Williams, we have just a few minutes on this to wrap this up.
Any values that resonate with you?
So inclusion definitely resonates with me. And I think you, especially you, are very much aware that I think that the voice of the community is very important in this work. They have to be heard. And I don't want the work of this council to be done to them. I want the work of this council to be done in partnership with them. This needs to, every community member is paying for this, and they need to have a voice to be a part of it. So when I saw the word, that was not my word. That wasn't my box. But when I saw it, that definitely resonated with me. And I want to make sure that we are inclusive of everybody in the community.
Thank you. Thank you, Dr.
There are two that stand out to me. Making evidence-based decisions, incredibly critical. And Liza, I don't know if this is your box, but I certainly agree with it. The intergenerational approach of including not just the worried about the next 5 years and the 10 years and the 1-year-old who will be 11, but including the 60-year-old grandparent who, well, we'll say 70-year-old grandparent who may have a time on their hands, figuring out a way to build them back into the family unit. So I love the idea of the two are intergenerational and making evidence-based decisions.
Thank you. Any other values that you see here that resonate? There was some that resonated with me, but I can't. It's more about the values that you guys are feeling. Any other values that stand out that you feel when we're done with that theory of change? There's a little section in the theory of change where we include the values of CSC Leon County, and that's where these words will go.
For me, I see opportunity for success. And when I think about my students and students like my students, they all have the potential, but some of them just won't have the opportunity to succeed because of their beginning. So having providing a pathway for the opportunity for success would bring it for me.
Okay, I just want to do a break check. Can I keep going or you guys need a break? Keep going. Okay. Okay, wonderful. So we had a chance, you guys gave us some thoughts around building that theory of change. Know that it takes many, many meetings to finalize a theory of change. So this is our first step. The work we're going to be doing in the community would be our second step. We're probably going to come back to you all with the findings from what the community is saying in terms of the different components of the theory of change. But for now, I wanted to take some time to hear your thoughts around the expectations. You guys have shared some of that with me today, your expectations around the asset and needs assessments. I put these questions up because these were the original questions you wanted answered as a result of the assessment. What programs and services are currently available for Leon County children, youth, and parents? Do these programs and services provide specific measurable outcomes that promote the public good? What barriers inhibit maximum fulfillment of current available programs and services? What gaps in services between currently available programs and services and the needs of those programs and services by Leon County children, youth, and parents? Based on those gaps, what options should CSC Leon consider for investment that could potentially yield the most significant returns? And the last questions you guys wanted answered was what process measures outcomes should be tracked by the programs and services? Are there any additional questions that are not included here that you feel are important that we try to answer with the assets and needs assessment project? Or does this include everything you want to know?
Nobody has said, they're not saying anything. For now, it seems very inclusive to me. But you know, I do want to reserve the right to get halfway down the road and say, can we talk about this too? And not to add more work, but just to, you know, as these interim reports come in, as we get data, other things may come to light, you know? And so hindsight's always 20/20, you know? And as we go down the road, I think we will realize there are other things that we may need. So not to scare you. It was not that we want to add anything on, but I would like for us to be able to come back to this question in maybe 2 or 3 months after we already start seeing some of the engagement, some of the information that's coming in.
Absolutely. So yes, you'll have the option to throw some questions in later as well. Yeah.
Well, so a question that I'm going to want to see thrown in throughout the process is number 2. Number 2 is really a follow-up to number 1, and that's the existing programs that are currently available. That's great that 1A is, do these programs and services provide specific and measurable outcomes? That's great. But every time you get to another question on, based on these gaps, what options should we consider? Oh, number 2 should be 5A or 5B, whatever, however you. Are those, you know, options, do they provide specific and measurable outcomes? To me, everything we do, that question should be the follow-up question. It's sort of, you know, should we consider A? Well, does A provide specific and measurable outcomes that promote the public good? So that would be my thought all the way through the process. Is number 2 isn't just a question that deals with the specific programs that currently exist, because just in terms of the directive we've been given by the voters, we're not dealing with those. What we're dealing with are ones that aren't being met and making sure that those have measurable outcomes, whichever ones we decide, and promote the public good.
I have a question, and I'm with Zandra. I'm fine with where it is. I know one of your next questions is going to be asking the community about these gaps and these programs and services. And so this is more a process question. I know you're going to be holding events and so forth to gather that information. I'm just wondering if we're going to have it also like on our website, so anyone will be able to respond. You know, how broad is that net? Because I think it needs to be as broad as possible, and that anyone who is interested is able to respond.
To the survey? So the goal is to try to hit every single provider that provides services to children, youth, and families. And it's quite an extensive list, and it doesn't exclude having businesses. It doesn't exclude having what we would consider non-traditional service providers. It could be private organizations. If you're serving children and families, then we're trying to know who you are, and we're trying to include you in this process.
I guess my question is more about the gaps. So let's say I'm a parent in Tallahassee, and I feel like the gap is that I don't have access to a mentor for my child, or I'm a business in Tallahassee, and I feel like if there was an incentive program, I would add early childhood education to my business. Is there a way for me to answer that gap question, even though I'm not a targeted entity?
Yes. Yes. So they would get the survey, the same survey that we're sending out, and it would include those questions about one, the needs. It would include questions about services that, this is from a private business who's providing the service, or a private business who is a recipient of services.
Dr. Williams, I think we could also maybe speak about the community survey. I think that's what Ms. Liza may be referring to be able to get the input of the parents, the community members. We had spoke with our local partners about potentially creating that very non-invasive 3-question survey to really get the perceptions of the community that way.
Yes, thank you. So one, we have the provider survey, and then there's another survey that we're looking to send out that really is focused on the needs of community members. And if you're a resident in the county, then you would be able to complete that, which would include gathering your perception around your needs, gathering your perceptions around barriers to services. So yes.
Okay, thank you. That was my question. Appreciate it.
So this kind of gets to what Ms. McFadden and Dr. Glenn have referenced in terms of inclusion. I mean, look, the current providers of services, by definition, that while they may have some insight, but they're providing services that we're not going to be providing. I hope that we are going to do more than just send out a survey to parents or give them an opportunity to go online. I hope that we're, and I absolutely want to sit in there, because I can tell you what I need. You know, it's like my grocery list is going to look very different than Rocky's grocery list, because, you know, I'm out of skim milk. He may have just bought a gallon. I want to I want to be there. I want to hear. I want to see the parents, and I want to see them on the northwest side of town, and the northeast side of town, and the southeast, central, and the southwest side of town. So that, yeah, that's incredibly important to me.
Absolutely, absolutely. And so just to sort of give you an idea in terms of how we're reaching out to folks. One is the survey that we just spoke about, where we're hoping to touch as many people as possible. But another opportunity, which is also dear to my heart, is being able to sit and have conversations with folks in the community around their needs. And so we talked a little bit about how you have secondary data that can help tell the story, but sometimes just having that secondary data is not enough. And you need the lived experiences behind the data. So our thought is that when we are engaging the community, that we're having conversations with them in different parts of the county, so that we can hear the stories about, you know, what are their barriers to services, what challenges are they experiencing. So yes, we're on the same page in that we need to hear the stories that explain the numbers that, you know, we might collect given secondary data that we might collect given the survey. So absolutely.
Maybe would it be possible for us to get a list of who is on that provider survey? So for example, in my mind, I used to manage a public relations firm. I think public relations firms could be awesome at addressing some of those gaps. I would want to make sure that all the universities and community colleges were there, specifically some specific places within the university. So I'm wondering if there's an opportunity for us to look at that provider list to make sure that if we have people that we think should be on it, I'm sure I'm not the only one who has sort of maybe outside the traditional box thinking, that we could maybe lean in on that. And, you know, being in Tallahassee, we have so many state agencies where I don't know what % of our parents are working, but, you know, I would want to make sure that, that you know, somewhere in those state agencies, they're responding to this and thinking about it.
Absolutely. We could make sure you guys get that list as well.
Thank you.
Okay, so it's always important for me with every project that we're doing that we get a sense from you all in terms of what would success look like. So the project is done, it's completed. How would you know that it was successfully implemented? What are some signs that it was done well? I can already picture you guys saying community engagement, and I'm on the same page. If the community is well engaged, that's an indication that it was successfully implemented. Are there any other indicators for you that this assets and needs assessment is successful?
Performance on the key measures and outcomes. You know, I would love to see data that shows that, you know, we are seeing changes in these particular measures. We are seeing changes in these outcomes. So it's great. I want to hear the stories from the community. I want to hear it from their mouths. You know, I want to see families coming in and talking about how these services have impacted them. So I want to hear that. And then I also want to see data based on the metrics that we were tracking that shows that we are seeing these changes within our community. So that's another indicator for me that shows me that we're trending towards success or going in the opposite direction. So,
Absolutely.
yeah.
Absolutely.
Is your question, when it says this project, you mean QQ's project, the project that you've been hired to perform?
So I want to say that this is everyone's project, but you're right.
But I mean,
Yeah.
not this project, the Children's Services Council for the next 10 years. This is specific to a needs assessment and finding out what the needs are, building in accountability components and finding programs that meet the needs and grading them based on those accountability components, right?
Yes.
So the answer to me would be, one, you would provide that to us, and two, this body of 10, we all have some pretty strong opinions. There's no shrinking violet up here. If programs were being proposed, a sign of success would be all 10 of us sitting there and saying, that's it, because we know there's a need in the community. We know this program will meet that need, and we can grade it, Dr. Glenn, to your point, over and it, unfortunately, we're not going to know in a year. You know, it will probably take a while, but we can begin to see some indicators. So it will be all 10 of us looking and saying, that's the one, or nah, that's not the one. Not on every single program, not on every single vote, but on the majority. And then to me, I will know that QQ succeeded in helping the 10 of us begin to focus.
You have a question. Are you talking about individual funded programs, or are you talking about the program in general?
That's why I asked that question about this project. This project, this refers to what QQ has been hired to do.
The needs assessment.
Right.
Okay.
So it's knowing what the need is, knowing what accountability components should look like to grade those needs, and then giving that to us and saying, okay, now you have X million dollars to fund over this next year. And at 3 o'clock, I'll go through the budget with you. And all of us look and say, there's some pretty easy answers. That there are, that we started with 166 applications for executive director. And at some point, 32 came to the top. At some point, 8 came to the top, at some point 5 came to the top, and at some point 1 came to the top. Same thing with these programs. There will be at least 166 organizations that come before us and say, you should give me some money. But only
Yes.
some are going to come to the top. And that, to me, when the 10 of us are in agreement with those 10, then I'll know that this
Yeah.
was a huge
So
success.
my response was not for an individual program. My response was, how do we know that there is success for the needs assessment, the work of the needs assessment, the work that Q&Q does? So not from, there are 10 people that are bidding to do this work and we've identified one. What I want to say is these are the indicators that we know that what they have brought forward to us is working. Does that make sense?
Kind of saying the same
Okay,
thing.
Yeah.
It's because of that,
Yeah.
all 10 of us will be like,
Yeah.
that's the one,
Makes sense.
Just for a point of clarification, I know you mentioned programs, and then I also heard you mention organizations. So there is a deliverable that's focused on evidence-based, promising, and innovative programs that exists on a national level, that exists here in the States. So when you mentioned both, I heard organizations and programs, I just want to hear, I just want you to clarify, are the thoughts that it's about, because you said which organizations rise to the top. If you could just clarify that one for me.
Yeah, well, you're giving me way too much credit for having thought through what the difference is. In fact, I'm not sure I know the difference. What I would say is, I may be interchanging those
Okay,
those terms. I think I'm really talking about
the program.
the program.
Any other thoughts? Yes.
What would be helpful for me is that, I know you guys have done this before. When you guys present something, the needs assessment to us, I would like to be able to clearly see what the voice of the community was and how that data and how that merges with what we came up with, and that it's very clear in front, succinct, detailed, to the point, that shows like this is the direction that the council needs to consider going in based on those dynamics.
Thank you for that.
Just very briefly, one of the things that impressed me with Q&Q when we were going through the analysis and the interviewing process is you all indicated your holistic approach to gathering the data initially. And you indicated that you would be talking to nonprofits that provide a certain amount of services, as well as all aspects of the community as well. So my satisfaction point would be that you have done that, maybe not 100%, but as best as you could have under the circumstances, especially dealing with the communities. But one of my concerns is what happens, or how do you measure the situation when you have reached out to various segments of the community in various times with surveys, forums, what have you, and you have certain segments that don't respond, perhaps because they don't feel that they need the services, or statistics indicate perhaps that their children are doing well, they don't need the services. So in Leon County, we could very well have some portions of the population that do not respond. So in your report and analysis to the Children's Services Council, how do you indicate that? How does that show as part of your analysis?
It's almost like, how do we capture the voices of folks that kind of feel like they wouldn't be a recipient of services that's funded through the Children's Services Council? And I think it goes back to just trying to cast out the biggest net that we can. And also the messaging. So if the messaging is around, we want to hear your voice because we feel you can benefit from the service, then I think you're right. What could happen is we're only hearing from folks that feel they need the service. But if the messaging is around, we're working together for all of our children to be able to reach their highest potential, then the hope is that folks who feel like, their kids don't need the services would still participate. So I do think a lot of it is around the messaging and how we communicate the need to participate and share.
And
So just a follow up. So in the final analysis, your report in identifying any gaps in specific areas for our services will be largely based on the responses that you receive. And it won't be an accountability for, I guess, the voids in certain situations where there's no response at all.
Yeah, I want to say that we're looking at, the secondary data does tell a story, right? So we do have secondary data that we're pulling. The survey, I have to say, is a big part of reaching out to folks and getting them to share their thoughts. I know we had some discussion in the past few days about different innovative ways to try to get at that, to have a place where folks can continuously feel like they can comment and share their thoughts. So we are exploring some of that, but I want to say that the community engagement piece is one, and how we select where we go to hear the voices is another way. So, you could say, we're thinking about how do we decide on the groups that we speak to, because we can't speak to the entire population, right? And so it could be in strategy thinking, how do we get folks that feel that things are going well? And how do we still hear from them in terms of, well, things are going well within your community, within your zip code, and still be able to hear their voices about their thoughts about other zip codes. Did you want to say something?
Yes, I did. I couldn't turn the button on. And just to follow up on that, I did want to bring to light one of the main focuses of our approach, because it's something that we're very common with, and we really take to heart, is that we understand we are a consulting, I'll take my mask off. We are a consulting firm that is coming into a community. We are not necessarily the members of Leon County. And we really try and do a good job of recognizing that position and being able to work with and leverage partnerships within the community. So working with fantastic partners that really have deep roots within the community, so they can help us leverage their expertise as community members to identify who are those groups. Who are the groups that we need to reach? Who might be those groups that, we don't think we need the services, and how can we be strategic in creating messaging that is going to speak to them in the best ways? Over the last few days, we've also talked about, as Dr. Williams has said, what are the best strategies? Is it having service providers print off a QR code in their business and encouraging the people that they serve to take that survey? Or how do we get these different groups out on a Saturday, maybe instead of a Tuesday night? Or maybe there's midnight football or soccer, sorry, in English, midnight soccer happening, and we go to that community. So I do want to let you know that that is something that is pivotal in our approach, is recognizing that a disadvantage of not being in the community is not being in the community. So being able to work with community leaders and organizations.
Any other thoughts in terms of indicators that the project was successfully implemented?
I just think, Doctor, in the report, based on what she just said, is informing us, your broad stroke of how you gather the documentation. And I'm sure you will do that. I'm sure we will be informed. In that way, I think not only the council, but I think the community at large will feel that, you've done a great service, or we've received a great service that we can use as our guide to provide the best services to the children and families in Leon County.
Yeah, and I just want to reiterate, we're asking them the same question, because I feel like this asset and needs assessment is just as much their product as well. And so we want to hear from them, what would make you feel that this is a success? So this question goes back to them as well. I did want to take some time to talk about aligning actions. And the reason that I think that this is important is we've worked with a number of funders, and I think one of the challenges that we have seen they experience is the thought of funding programs in such a way that it doesn't necessarily allow them to collaborate in a way that they're all working towards the same goal. So one of the things I just want to pause for a minute and talk about, how can we, moving forward as we're thinking about this work, break silos within the county in terms of how folks are working together. You can fund individual programs, and we've always funded individual programs, and there are some benefits to that. But I do want to just consider, what would it look like if we thought about how in this position can we encourage collaboration with partners? What are some things that we can do to help them to sort of align their actions so that they're not trying to solve what we know is a very complex, challenging, everything you all mentioned today, these are complex issues. And the thought that, a single provider or, 1, 2, 3 providers can actually, solve some of these complex issues alone, it's a tough sell. And so I just wanted to pause a little bit about your thoughts around, is there anything that can be done to motivate, to encourage, to support collaboration as you guys move forward in this work?
So that's a really good point. I have a medical background, and I'm hearing you asking for team-based care as opposed for fee-for-service. So in a fee-for-service environment, you pay the doctor for the services they provide, then you pay the pharmacist, then you pay the nutritionist, and they're in their silos and they get paid for what they do. With team-based care, the team gets paid for their collaboration and working together to make someone healthy and happy. So and it was interesting when you said that, and I was like, that's a really cool idea of working or asking some of these partners to collaborate with each other to form teams. And I'm just making this up as I go, but as they form these teams and the services go to the team, not necessarily to individual organizations, that forces collaboration, that creates relationships that aren't necessarily here yet. So I don't know, that just came to my mind as you were speaking, and I think that's a really unique way for us to approach this. Another way of approaching this too is, value-based care. You get paid based on value, not based on providing the service. So, as we think about how we put some of these contracts together, the payment is based on outcomes, not simply because a service was provided. So we're not counting widgets, we're counting outcomes, and tying payment and collaboration to that, I think, is a unique way for us to think through some of these things.
You give the best analogy. Yes, absolutely. So, and I'm happy you brought some of those points, because I'm sure if you guys have spoken to nonprofits, one of the things you hear is in terms of capacity. So they might have capacity to do one component, and then another organization has the capacity to do another component. But just the thought of what would it look like if folks thought together in terms of a goal that they're all trying to aim towards, because there's a lot of goals that different organizations are working towards, but really haven't had the space to think about how can we pull our efforts together to try to reach that goal. And so I did want you guys to, any other thoughts, please?
Well, I noticed Abena's here, so I wanted to thank her for coming from the city. And I know behind the scenes that the city, the county United Way, and Ted started some conversations about, could we move toward aligned outcomes? And I think that's really important strategy conversation. But I wanted to add on to what Xandra was saying with 2 ideas. The first is, at one point in my life, I was able to work with the X Prize Foundation. And so, we put out a $7 million prize for whoever could come up with the best literacy app in the world. And we had 117 teams from around the world compete, and they put together, their teams are for-profit, nonprofit, et cetera. And, within 3 years of launching that, our foundation became the largest online provider of literacy services, because it was such a big idea that the impact was amazing. So I go to your idea of, funding, that we should think out of the box. We shouldn't just think about, how it's done today. But, I know in a lot of cities throughout the United States, social impact bonds, where private investors come in afterwards and government only agrees to pay based on outcomes, would be another model, I think, much to your point of looking at different strategies to leverage additional dollars to align actions. So I'm a huge supporter of social impact bonds and looking at, X prizes or whatever you want to call strategies that get people to compete against one another, that bring out the best in everyone. And frankly, might even bring people that are not from Leon County here to try some of their most innovative ideas. So, and then I guess third, I think the work that's already started behind the scenes on, aligning those outcomes so that as a community between the CHSP, the United Way, the managing entity, those, and then Children's Services Councils, those will be the four big players in the children's space. And if they have aligned outcomes, it will go really far to people investing in aligned ways.
Yes, thank you for that. And as you were talking, I was picturing we had to do some work with a number of grantees, and we were talking to them about outcomes and how can they determine whether or not their efforts are really leading to the outcomes that they want. And one of the things that stood out for me is what they said was, just tell me what the funder wants me to collect and I'll collect it. Just what is it? Because we wanted to involve them in that process to decide what outcomes they should be collecting. But there was this push just to do what the funder wants. And that's what I'm hoping won't happen, because I'm hoping that the thought is that we want to figure out what outcomes are important to us so that we could decide whether or not we're making a change, that we can make modifications. And so as you're thinking about this work and we're engaging different providers, the hope is that the onus on the outcomes are not just for reporting out, but it's for them to figure out, okay, which part of the work is not working so well and where do I need to make the change? And that leads me to, I think we talked a lot about that change. And I want to point out that just the thought of, when you're trying to bring people to the table to work together, to think about how they can make that change, that it does take time. It takes time for it to happen, but it doesn't mean that we're not still checking a year from now to see how we're doing in terms of moving the needle. We're not still checking 5 years down the road. So I did want to point out that change does take time. And this one slide I wanted to share because, so we talked about how we're going to think about strategies that work in the community that we're trying to serve, and then we're going to implement them. And then there's sometimes this thought about whether or not the strategy was successful or whether it failed. And I want to caution us as we're doing this work that we're not just thinking about did they meet the outcomes or they didn't meet the outcomes, but there is a point where we're talking about what did we learn from the work. So I say that because I think that many times grantees will forget about the learning that happens along the way. So we're implementing strategies. Our hope is that all the strategies we implement is going to lead to the impact that we want to see. But there's some strategies that it's possible may not work. And what happens? What do we do with that? And so it's encouraging us to say, we do take a pause, we learn from that, we ask the grantees, it's not just, did you meet the outcomes or you didn't meet the outcomes, but tell me, what did you learn along the way? What didn't work? We assumed it was gonna work, but it didn't work. And tell us why, what needed to be changed. And so that way of thinking is helping the community at large think about, let's stop and learn from the work and not just, determine we've done it or we didn't do it, because that's just not real life. So I did want to pause for that moment and hear your thoughts about that learning aspect.
I'm a huge supporter of empowering people to fail, because yeah, it seems a little counterintuitive to empower someone to fail, but if you spend $10 to implement a strategy and it succeeds, it's $10 well spent. If you spend $10 to implement a strategy and it fails, and that's $10 that was wasted, unless you learn something from it. You don't know that it's worth $10, but it's certainly worth more than zero. So empowering folks to fail means that we're empowering them to make sort of bold decisions that may lead us to something we've never found before. Those are my thoughts on that.
Yeah. Thank you for that. And I think that in order for folks to feel comfortable sharing, when they fail, there has to be sort of that space, that we're here to just not hear about the successes, but we want you to feel comfortable sharing what has not worked. In the work that we've done in many communities, what we have found with many grantees is sometimes they're afraid to say when it didn't work so well, because there is a strong focus around, when there should be a focus around meeting those outcomes. But I think they fear that saying that they failed in a particular component, just doesn't, it's going to be perceived poorly. And so they don't feel as comfortable sharing that learning. So I do want to share that. Let's think about the learning and let's encourage a space for folks to feel comfortable sharing what they've learned. I think that was my last slide. Oh. And so although this was, our chance to sort of talk through goals and impact and outcomes and what we want to see and concerns about what we don't want to see and expectations, I do want to let you know that, throughout this process, at any time, anyone can still pose a question. Anyone can still share a thought. You might be at home this evening and you're sitting, relaxing, and a thought comes. I should have told Sandra about this thought. So please feel free to reach out and still continue to keep this dialogue open and share this thoughts.
Can I ask a question back to the needs assessment and community involvement? What is your vision of what community involvement looks like? Are we talking about 300,000 residents in Leon County having the opportunity to weigh in on this issue? My 80-year-old mother, father, parents, kids. So what is the vision?
Yeah, I think the vision is twofold. One, keep in mind that there's this focus on reaching out to anyone in terms of agencies. We talked a little bit about still reaching out to business owners, other folks that might have still provide services to youth. And so there's that aspect. And then the other aspect we talked about earlier was still having a survey that is available to all residents, including your grandma or anyone else.
Okay.
So it will be still available for everyone. I think we're really trying to work with the partners to be able to get that survey out. We're trying to provide it in multiple, using the QR code, having it anywhere that we can get that survey out for folks to complete. That's our goal.
So we have, you have a captive audience with our public school system. We have 60,000 plus parents. And so if you do take your show on the road, you're more than welcome to use our facilities that are located in different parts of the county. And
Thank you. That would be awesome.
I will say though, sometimes getting people to come is challenging unless you feed them, right? If you feed them, they will come. But however we can help and partner with you as the public school system, we're all in. And if you need me to help make connections with private schools and charter schools and others, I'll be more than happy to do that.
Awesome. Thank you. Thank you so much for that.
Great. Well, thank you, Dr. Williams. I learned a lot. But it was also great just to be able to share our thoughts, and now I feel like we're moving forward with our vision. So thank you for all of your information, and we look forward to continue to work with you. And at this time, we're going to adjourn. Ted? We're earlier than we projected, so we can adjourn, or?
Actually, that's what I was just asking our general counsel,
Oh,
because it
okay.
appeared we were ending early. And because of the public notice requirements, et cetera, we will need to adjourn. However, and we will not be able to begin the second meeting until 3:15 when it's noticed. However, Dr. Glenn's report on the needs assessment is about the subject of this workshop. Okay. And so in order to save perhaps some time from that meeting agenda, am I correct on this now? We could ask Dr. Glenn, there's not going to be any vote taken or any decision made on her presentation. It's an update on the needs assessment, which is what this workshop is about, that perhaps we could do that now and save that time instead of expending it later. Is that possible?
Dr. Glenn, I think if you'd like to foreshadow what you intended to discuss during the noticed full council meeting, you can have that discussion now. But it does appear on the agenda, members of the public who might have seen the agenda might want the benefit of hearing that discussion at its regularly scheduled time. But my thought is, anything other than just a brief overview here, you probably want to wait until the council meeting.
Okay, then I'll wait until the council meeting, and instead of doing a summary and then the.
We tried.
Yeah, we did try.
So at this point, if you have concluded, then we'll need to wait until 3:15 to begin the meeting.
So the meeting is adjourned.
Well,
Workshop is.
momentarily, I would ask, Ms. McPhail has done, and she's the project manager and was on the ITN, and she's been working very, very closely with various groups in the community and with our QQ friends. I guess if it would be the pleasure of the council, if Ms. McPhail has any comments regarding what you've thought about or any updates on what has transpired at this point that would be appropriate to provide, would that be of interest?
Absolutely.
Yes. But we still get our break?
Talk about being put on the spot. Holy cow. So Holly, yeah, you have the next 45 minutes to fill.
It's my great pleasure to introduce to you our operations manager, Ms. Holly McPhail.
Right.
Welcome, Ms. McPhail.
Too funny. I don't want to steal Dr. Glenn's thunder in terms of all the work and the preparation that she's going to present, but I do want to respond a little bit to the questions related to how the community engagement piece will be done, because that's so integral to the process to ensure, while they're the experts in terms of research and being able to bring all of that in. I loved what Lexi shared with you in terms of the real experts are the folks that are kind of in the room, that show up to all of our meetings, that are connected to the service providers, and those service providers that are connected to the families or the chambers that we're constantly working with. So as we brought on QQ, one of the key things that was very important to not only the needs assessment group, but of course to staff, was ensuring that the community providers were open and welcome to working with QQ. So all of that legwork kind of happened. Emails went out, meetings that Ted and I conducted mostly via Zoom with a variety funders in our community, from the United Ways, from not the United Ways plural, just the one United Way, from United Way to CHSP, who you're going to learn about during our meeting, to the Community Foundation, to talking with various program providers that are out there, as well as what I like to call the convening agencies, United Partners for Human Services, Whole Child Leon, the various different organizations that are out there that are in this space
setting that up, including a gentleman who's been back here who's in almost, I think, addressed the council at almost every meeting. We are all we need, understanding their connection to what I like to say, the corners of our community that don't always get a light shown on them. So our process in preparing them to come up even for this visit was to build time in their schedule while they were here to meet one-on-one with some of these providers, whether it was related to the key outcomes and measures. I'll start using acronyms, the KOM and the IPI and the CPI, which is all about the work plan, but the key outcomes and measures, who do they need to meet with so that we can generate alignment or understand where we want to go as a community. The comprehensive programs inventory that you heard, the survey that's going to be related to, the informative programs inventory where that secondary analysis pool is going to come from, as well as, of course, the gap analysis, and then the 2 funding options for expedited funding and that longer term investments. The piece that I want to just kind of hone in on, and it's one of your slides, and just one piece that I'm going to steal, is about community engagement. So it's not just about a survey that's going to providers or a survey that's going to families. It's focus groups, which are the smaller meetings that are happening all over with very defined audiences, whether it's your 80-year-old grandma or the mom with a special needs kid or the midnight soccer that's happening at Level Up, right? Like, what are those kind of more special populations that we really want to hone in on and focus on? Having focus groups, intimate conversations with those folks. Then there's the larger community forums that would be the bigger groups that we absolutely might need a Leon County Community Center or a school, a cafeteria, whatever that might be, where we would have larger folks, a larger gathering of folks come together. And I 100% agree that you have to feed them. And if you want parents, you also have to provide childcare. So I want to put that out there as lessons that I think that we've all learned in trying to do this work. All of that's built into the work plan. And the other piece that's very integral to the work plan is how each step informs the other. How when the draft gap analysis is produced and given to the council for review, how is that gap analysis being used to inform the draft funding options A? And then how will the final inform draft funding options B, or the final funding options for B? How does that all work together? And so it's this continuous process. And while Dr. Glenn will show you snippets of the work plan, it is, Lexi, how many columns? It's an insane amount of columns that you kind of see. And
There's so many I don't know.
Right. So looking through how it's all just kind of integrated together, I think that you'll be really, really pleased when you hear the full report from Dr. Glenn. But I did just want to stress that piece on community engagement and how important our provider network, our partners will be, each of you will be in getting the word out on not only how to complete the survey, but how to put your name in potentially for the focus groups, how to come together, whether the focus groups are for the providers or if they're for families, and how they get the invitation, how they RSVP. And as soon as Ms. McFadden asked the question about, is it going to be posted on our website? Lexi looked at me, I was like, yep, of course. Like, what do we need to do? We're here to make sure that any of your ideas on how to get the word out, the whole team, whether, and the needs assessment team that I might refer to QQ as, they really are an extension of your staff. So we're here, all of us, to support the will of the council and the direction of the council.
Can I just comment on that? And I'm glad you brought that up because I almost said something when you asked the question. One of the main reasons why these 2 young ladies are sitting here in front of us is because of the significant level of community engagement that they offered as a part of the body of work that they're going to do. It is so much beyond just a survey. That was one thing that we were adamant. I'm not going to do a survey. I'm not. You didn't do this survey, you know.
I didn't even do their survey.
Right, I know.
Well,
so
I would.
Absolutely. So but we wanted to make sure that they. I know.
Well, I would have gotten busted if I wasn't in it.
No, but we
It
just
was
wanted
anonymous.
to make sure.
You're an honest man.
We got 70%, I've been told.
Aw,
Only 3 of you didn't do it, and now we know one
Well,
of
now
them.
you know
we're one of those.
We know one.
But we
know
just
that he
wanted
needs
to make
skim milk.
sure that they were actually sitting down and having conversations. Our phrase was, what was it? Authentic community engagement. We wanted to make sure that was significant, really there. So, she didn't really stress it much, but I'm glad Holly came back because I was going to say it when we convened and had the update at 3 o'clock. But
Something, and again, this is not me bashing the current vendors and providers. To the contrary, I think they're doing really important stuff. But again, they're providing services that we will not be providing. By virtue of the fact that they're currently providing services, they will know of gaps in services. But I'll tell you, Ms. Connor, when I think about those kids that are walking into your school on a Tuesday instead of a Monday, not prepared for kindergarten, their parents, there's a gap in services. That's a gap in services, and their parents may be receiving services from one of the providers, but then again, they may not. And I think using that data and that information and sitting down with, a single mother or a single father or a married a couple and saying, what are the challenges you're facing? Again, we all sort of come to this table with our own filter, and we think we have the answer to the problem that single mom or single father or family is going through. But until we actually ask them and listen, we don't. And again, no offense to the service providers, they don't either. They're doing the best they can, providing the services they're currently providing. So that's why I love the idea of small focus groups, because I think they're probably more likely to share the struggles they're having. But we really need to talk to those folks.
I would also say the community involvement and engagement is going to also speak to the naysayers about this council being formed at all and from the beginning. And they say, man, they want my input on what do I see? What do I think they need? Now, you know, some that say they don't need anything. I didn't vote for this, I didn't support it, but at least they'll say that we are trying to get input from everyone in the community. In addition to what Mr. Mitchell said, we're obviously looking for programs and services that don't exist. That's why there are gaps. Maybe some of these organizations have the capacity to build additional programs or services under their umbrella. Maybe they don't. Maybe a whole new organization has to be formed in order to fill some of these gaps. We won't know until we dig much deeper.
One of the things I'd like to share just on the subject of community engagement, as it relates to the needs assessment, but also as it relates to the work that you as a council are going to do for the years to come. And that is that continuous community engagement. And I think one of the lessons that as an organization that we can really look to, not to completely pat Leon County Schools on the back, but three of you, well, two today and usually a third, are very engaged in this. And that's the work of Early Learning Leon and how they did those listening sessions. So Mr. Superintendent, I know you were involved with that, but how you advertised, how you went specifically to do listening for how do we look at kindergarten readiness? How do we bring in all the partners, business partners, I know the chambers are at the table, private providers are at the table, nonprofits are at the table in terms of moving that work forward. But the most important ingredient, which is at the table, is the parents themselves, and that you took the time to listen. And you went, I think, 4, maybe 5 over the course of
yeah, and you
5
have
or
to be
6
kind of
weeks.
careful your approach to some of these providers. They get itchy, scary, because they don't know what is the. Are you trying to shut me down? Are you trying to take resources away? Are you trying to, why am I here? So you have to first assure them you come from a good place and you're just value their input and them giving back. And that's when we went to all the private providers to say, how can our public school system help you help our children that will one day be served by Leon County Schools? They were kind of worried that, are you trying to take my kids? Am I going to shut us down, or what are you doing? Are you trying to grade my program? So you have to be careful how you approach it with kids' gloves. But their input is critical. And we have over 200 private or around 200 private providers, early learning providers in our community And it was my vision that, because we can always blame them, why aren't they ready for kindergarten? Well, it's those damn pre-K programs. They just aren't, doing what they're supposed to be doing. But at the end of the day, it's our responsibility to have them reading at grade level by third grade. And what can we do to face backwards to put more resources on the front end to get them better prepared for their K-12 experience? And another, I don't know if we thought about a marketing campaign or us putting some dollars behind marketing to help get the word out in the community about engagement and getting some feedback from our community members through WCTV or through Democrat or through social media, but it may be worth spending a little money in order to make sure that we're successful in getting some of that feedback. And this wasn't meant for the workshop. I just came into my head and out of my mouth.
Can
We have to talk to the money man.
Super. I think those are very good points. And I want to add on just a couple more. As we think about who gets the survey, there are people that will have outsized influence long-term on a funding strategy. And so we happen to be the capital, and every legislator that comes here votes on bills that impact children. And so we, if we go and ask every legislator, not all of them or not all of their aides will complete it, but the fact that we went and asked them purposely to say you live in this community half of the time you're here, I think will, pay dividends in the long run. And I feel pretty strongly the same way. Every elected official should make sure that they are personally asked, people that are heads of the state departments, et cetera, because they are influencers long-term on building the financial capability of children's services, not just about the small $10 million we have, but long-term, what does that become and how do we leverage really big influence?
I love that you put that. And actually, Lexi and Sandra, when you read your emails, because in our list that we have currently, I don't think that we included state agencies. I'm not sure that we actually included the educational institutions with intention. So I've already made a note of that and sent an email like, hey, let's brainstorm on how we're going to do that. So thank you. The chambers and the businesses were always included from the forefront, but had not thought about intentionally doing outreach to not only just FSU, FAMU, and TCC, but also some of the other educational institutions that we have here, Lively, Kaiser, a couple of others. And then of course the state agencies, they admittedly were not on the original list that we put together. So thank you for that. And an email's already gone through to make sure that we revise what that list is. But I'll also share just a little bit in terms of process of the survey. And I'm just gonna start with the provider survey first. And it's a fairly lengthy survey. I'm doing a quick pilot with potentially 3 organizations that vary in their scope, the types of services, who they receive funding by, et cetera. So like a super, I'm gonna say tiny, I don't wanna say small impact because it's huge impact that they're likely having in the lives of families, but a small organization that isn't super well established, doesn't have a lot of various funding streams, a middle one, and then one of our larger, an agency that has multiple programs that they fund and provide services to. So our plan is to kind of pilot that survey before it actually goes out into the large community to all of the providers that we have. So be on the lookout for a copy of the long list that we will be sending it out to. And again, any ideas that you have for how to market it, from the QR code that we talked about, posting it on our website, using our community partnerships, using the Leon County Schools Focus System, direct outreach to all of the elected officials. I love the idea of the legislative aides. Again, hadn't thought about that either. So any of those ideas, feel free to shoot directly to Ted or myself and to Sandra and Lexi. You'll have kind of the opportunity to share your thoughts and ideas. This is a collaborative process for sure. All completely open and subject to public records.
Thank you very much. I'm excited about this because I think about open forums at schools, and one of the most populated times in schools like mine would be during performance. So, I'm brainstorming and thinking of other schools. You all could be like a commercial break and everybody pulls out their phone and complete the survey. You get a lot that way. So we'll think about that, superintendent, as a way to do that.
Yes, ma'am. Just to add one thing to what Holly said. She mentioned how each of the deliverables is going to inform the other. The sequencing of this is also really important because we're talking about these engagement sessions, but that initial survey, the surveys that are going out will be done first so that they will inform the conversation that will happen during the community engagement pieces. So we won't be going in blank in those sessions saying, well, what do you think? We will already have that information available to us so we can maybe dive deeper with those that who we're engaging with during those sessions.
So Ted, hold on just a second. So you're saying that, and I agree, one builds on the other, but we're starting with the provider community and that's going to drive our discussions with the individual families?
The provider survey is going to be going out hopefully next week as soon as we can get it. And that will inform the initial focus groups, and please correct me if I'm wrong, or that will take place in the 1st of January.
So again, I have no problem with that. I just think sometimes when you do it the same way again and again, you get the same outcome. And it isn't that the services that are being provided aren't valuable. I am just very nervous that they're going to come up with the same conclusions. And we are going to miss an opportunity. Maybe none exist. Maybe there are no creative ways that nobody's thought of any before. But kind of to Ms. McFadden's point, by reaching out to elected officials and appointed officials, those ideas are free. They don't cost a single penny. And as the treasurer, I endorse that. I also just want to make sure that if there was a reason that when the Children's Services Council was established, there were 5 of us who had nothing to do with government. That's how the statute reads. They're selected by the county and appointed by the governor. That is with the idea, I think, that we're going to bring a new way of looking at it. And so if we go just to the providers and they dictate everything from that point forward.
Yeah, I just want a point of clarification. No, it wouldn't just be the providers. And I think because we said provider survey, I want to make it clear that we talked about including businesses, so every different target that we talked about today will be included. And I think what we have to do is scratch out the provider survey because it completely, yeah.
And also we have the community member survey, we will have the community member survey that's working in tangent so that we're able to have perspectives of both types of community members because all of the community engagement sessions will be happening within the same time span. So we do want to collect that data both from the service providers, both from the parents, the youth, so that they can inform their respective engagement.
One of the things, it's something a little redundant here that Ms. McFadden said, I should just let you do the talking. Is surveying the businesses who may have an employee that they know of a service that is not currently being provided and a need that's not being met of that employee who is making them show up late to work or not being as productive because they're worried about their children or worried about their whatever. Or they have come up with an innovative idea to provide a service to their employee that they need some help. And that may be something that we can come up with. So, okay, I feel much better.
I love it, absolutely. And I think it goes back to that question about how are we going to define partners, right? Are we just going to say partners are just the service providers? And I think what we're saying, no, a partner is anyone in the community, business, whether it be some of the folks you just mentioned, we want to hear from them as well and consider them a partner in the work. So absolutely, no, I don't want you to think that we're limiting it to just service providers. We're saying, no, that's not the approach, that we're going to think about including businesses, including folks that also have an understanding of the needs. And it can be, the person who owns the laundromat in one part of town. So yeah, the thought is, if you're part of Leon County, you have a sense of what those needs can be for children and families and communities. So no, absolutely, we're on the same page.
Okay, thank you. All right, so now our meeting is adjourned and we will come back at 3:15. Right. All right, thank you.